This webinar is scheduled for 1 hour. And during this webinar, you may type questions in the Q&A section. So keep in mind, we may answer your question in this presentation. Any questions that are unanswered may be sent to us via our email, or if you'd like to contact our insurance line, we'll provide this information a little later. If you do have any confidential questions about care, please email us or call us so we can discuss that specific situation further. Thank you very much, and we'll begin.
We are recording this webinar, and as May said, it'll be stored on our website a little bit later today. If you're unfamiliar with the way to ask questions, this is a picture of the control panel, and you can enter your questions on the Q&A, as she said, and we'll answer those live so everybody has a chance to hear the answer. My name is Jill Batika, and I am the Insurance Billing and Medical Records Manager here at Student Health on campus at UC San Diego. Today, I'm accompanied by Maybelline Vitas, who is a whiz at giving presentations, and she'll give you lots of good information about the health insurance requirement, as well as what the health plan will supply to you and how to waive out of it if you have your own insurance that you want to use. The agenda today, we're going to give you information on the health insurance requirement, how to access care at our student health and wellbeing clinic here on campus, what our student health insurance plan has to offer for you, the benefits of the plan, and the health fee waiver, which is how you avoid paying the health insurance requirement. We'll also talk to you about the reduced access fee for Tritons, which is a membership or concierge medicine in order to have services at our student health clinic without having a financial burden. We'll also address any questions and hopefully give you the answers that you need to make a good decision.
We provided a picture of the student health clinic on campus. We are located right on Library Walk, the center of it, across from the Price Center Eateries and the Target, along with the bookstore. Just keep in mind that the student health clinic is the primary care home for all registered students on campus. We did want to provide you with a picture of the beautiful UCSD Jacobs Medical Center. That's just about a quick walk or a shuttle ride away from campus. We also provided you with some helpful QR codes that can direct you to the student health website. It does provide a bunch of information for healthcare, the immunizations, and health insurance insight. You'll see these QR codes pop up in the future slides as well.
So what is SHIP? SHIP is an acronym for Student Health Insurance Plan. And all universities and colleges throughout the United States do require that students have health insurance while they attend their campuses. SHIP is the acronym. It is managed and operated, and the claims payment process goes through a company called Anthem Blue Cross. It was established at San Diego in 2011, and it's here to protect the students and our campus from any adverse situations. It was built for students with students actively involved in its design. UC SHIP provides high quality, affordable, and convenient coverage that protects students from unexpected healthcare costs. All UCSD students have access to student health and our counseling and psychological services throughout the campus. If you're referred to an outside provider, you will use a SHIP coverage and the insurance or the insurance that you waived with to access specialty care benefits. Students seen at Student Health are categorized with one of the 3 payer designations here in our clinic. You either will have the student health insurance plan, you'll have our RAFT, which we'll talk about a little bit later, or you'll be considered fee for service. And that means that you've waived the SHIP, you didn't want a RAFT, and you have your own insurance. We don't have contracts with insurance companies other than the one that's supplied through the school. So we won't be able to bill your insurance company for services if you do waive the SHIP. We will help you by providing you with itemized statements that you can send to your insurance company and seek reimbursement on the back end. One thing I'd like you to consider is that we generally are considered out of network because we don't hold contracts with insurance companies other than our own. The fee for the insurance you'll see on your student statement, and I strongly encourage you to look at that on a regular basis. You'll see a charge each quarter. If you're a graduate student, the charge per quarter for the insurance, the premium that you'll pay is $1,881. Or if you're an undergraduate, it's going to be $898 per quarter. That happens 3 times for our fall quarter, our winter quarter, and spring. The spring quarter payment covers you over the summer so that you're covered 365 days. The insurance does provide coverage outside of our campus. And if you're home on break and it's outside of our geographical area, we encourage you to use any of the UC systems within the state of California. If you live near UCLA or UC Irvine or UC San Francisco, you can use your SHIP benefits the same way you would here. Even if you waive, you can still use the student health centers throughout the state of California. If you're not near a UC facility, then you're going to want to contact Anthem Blue Cross, and they'll give you provider names that you can use in your community to access your benefits. You just have to have a prior authorization from our student health clinic here, and you call us to get one of those. All students are welcome at Student Health and Wellbeing on our campus. And you can use all of the UC student health clinics throughout the state. For students that have the SHIP participants, the student health clinic on campus is your primary care home. So you always start your care here. If it's a routine or urgent, you can come through our urgent care and have services if you don't schedule an appointment. But for routine care, you need to contact one of our providers, schedule an appointment, and have your services rendered here. If you need to see a specialist of any sort, or you have to have a diagnostic service, one of our providers here is going to write you a referral so that you can use that either at our UCSD health system or another contracted provider under Anthem to access care and have your benefits paid. When you come to the student health clinic, we have doctors, nurse practitioners, registered nurses. We have an X-ray unit. We have a full laboratory. We have a pharmacy that we do prescriptions, and they also sell over-the-counter items for a very reduced fee. We have an urgent care available to you at the same time as we're open if you don't schedule an appointment beforehand. We have optometry available to you, and we have glasses that you can purchase or contact lenses. We provide immunizations. We have a dietitian and nutritionist, social workers, and we also team with our counseling and psychological services departments throughout the campus. And we have much more. We have an insurance department that will help you and direct you to get the benefits that you need at an affordable rate. The payer classifications, again, when you do come into the student health clinic, you again will be either categorized as a student health insurance plan member. You will be considered fee for service if you've waived, and we do require that you pay by credit card at the time of service. If you don't, it'll be transferred to your student account where you can pay it later. And RAFT. And again, we'll go over that reduced access fee for Triton's membership, so you can make a good decision when you're either filing a waiver or picking SHIP.
As Jill mentioned, the student health clinic is for all registered students. We are open all year round long and during the school breaks. Monday through Friday, the clinic is open from 8 a.m. On Mondays, Mondays from 8 a.m. to 6 p.m. Tuesday, Wednesday, and Friday from 8 a.m. to 4 p.m. Thursdays, we open at 9 a.m. through 4 p.m. And this is each quarter, fall, winter, and spring. Summer is included, and we'll discuss that a little later. But please call the Student Health Clinic or log onto the My Student chart to schedule an appointment. For students needing further medical direction, during our closed hours, we do ask to contact the main line, which is 858-534-3300. And this is to speak with the registered nurse that can assist you, advise you on what to do regardless of your health plan. If you keep the SHIP, if you opt in for RAFT, or if you opt in for fee for service and pay out of pocket, you'll still be able to get the clinical advice from a nurse. And again, for anyone covered under UC SHIP, this is your first start to your medical care. Student health is your primary care home. And so we're going to discuss a little more about the benefits that UC SHIP offers. So let's go and talk more about that. And to get a copy of the student's insurance card, Anthem Blue Cross manages the medical care, and they do not mail out insurance cards. And so you'll want to download the Sydney app, which looks like a ghost, to receive your digital insurance card. This app will provide you with a copy of the front and back of your insurance card, like a hard copy. And this app will also allow you to view your claims processed under your subscriber ID. The app also allows you to look up providers and facilities contracted with Anthem Blue Cross. And so we are being ecologically minded and no longer mail out the cards. But once you have access to your electronic insurance card, you'll be able to reach out to Anthem Blue Cross directly and request a hard copy sent to you.
Under the UC SHIP insurance plan, you have 3 tiers of benefits that are available to you. The model is a PPO benefit, which is a participating provider organization benefit. And if you have an insurance right now, if you take a look at the front of your insurance card, it'll generally tell you if you are a PPO member, a POS, which is point of service member, or if you have a HMO, which is a health maintenance organization. Under this plan, it is a PPO benefit, but there is a referral requirement that has to be in place in order for the claims to be processed effectively. But you do have some versatility. You get to pick where you want to go and when you want to go there if you do receive a specialty care referral or you need to have hospital-based medicine provided to you. Under that first box, under the UC providers, our UC health system throughout the state of California does provide a discount to our students. The benefit is payable at 90% and you pay 10% out of pocket. There is no deductible on this tier of benefits, so there's nothing for you to pay beforehand. You would only pay co-insurance or a copay to see a specialist. To see a specialist at the UC health system, it's a $10 copay to see a specialist and $5 for a mental health specialist. Under this tier, you have a shuttle ride right from our campus that will take you to the UC facilities where the specialists are housed and the hospital-based medicine is available to you. We have 3 acute hospitals that equate to about 1,200 beds in the city of San Diego. There are, as I said, about 300 specialists available to you from allergy to x-ray and all in between. So take a look at our website at ucsdhealth.edu, and you'll be able to see the facilities as well as who the specialists are if you do have a chronic illness or you want to find some more information about specialty care available to you. Again, under this tier of benefits, it's a $10 copay to see a specialist and 90% is covered for diagnostic and hospital-based medicine. Under the second tier of benefits, you have the Anthem Network available to you. If you're using the second tier of benefits, that means that you're not going to a UC provider or facility, but you're seeking care at an Anthem Blue Cross PPO contracted provider. You can find providers by calling Anthem at their 866 number or using a Find a Provider tool on the anthem.com website. This particular tier, if you're having hospital-based medicine or if you're admitted to a hospital, requires a $500 deductible be met first before they'll start paying on the claims. So if you're admitted to the hospital, you pay the first $500 of the bill, and then Anthem will pay 80% thereafter, leaving you with 20% coinsurance. To see a specialist under this tier of benefits, it's a $30 copay. So keep that in mind. On the third tier of benefits, which we highly discourage, and it's because it may provide you with a financial burden that's beyond your means. But if you do want to use an out-of-network provider, that means that this provider that you're going to see doesn't hold a contract with the UC system. They don't hold a contract with Anthem Blue Cross, and they're out there privately. Generally, these providers do expect you to pay upfront for the services, and then you would seek reimbursement on the back end through the insurance company. You pay $1,000 in deductible first, so you're paying $1,000 worth of the bill upfront, and then you would seek reimbursement from Anthem at 60%, leaving you with 40% coinsurance. And that would be for a specialty provider as well as hospital-based medicine. This is the highest out-of-pocket experience that you'll encounter under this plan. If you do need help in finding an in-network provider, either under the Anthem network or through UC, we're here to help you.
For mental health or behavioral health care, we do partner with our Counseling and Psychological Services Department on campus, known as CAPS. They have same-day appointments, or they can even write you a referral to see a provider off campus. We do recommend students to check out the Live Health online resource, which is free. And there is a coupon code on the website supplied below. Referrals to off-campus providers are $5 per visit at UCSD Health or with the UC Health provider. And with a provider that accepts Anthem Blue Cross, there would be a $10 copay per visit. So this is a list of urgent care and emergency room facilities near our campus that can help if you aren't open, or if we aren't open, and if you're experiencing an urgent care situation. For your own cost savings, please always try to use the student health clinic on campus for preventative or routine care. The ER comes with a hefty copay, and it's reserved for unexpected incidences that require immediate medical care. If you have an urgent situation that you would like to be seen for and the student health clinic is not open, please visit the urgent care on Villa La Jolla Drive that caters the community. If you do schedule an urgent care visit on the My Student chart and see wait times, you'll then need direction to contact. You'll need direction, or if you do need to contact a provider, please call the main line, the 858-534-3300 line to speak to a nurse. So I would recommend keeping that slide handy in case you need to know where to go for medical care. It's really important to know about your plan before you need to use it. So this slide's really important. Thank you, Jill.
And just a reminder, referrals for care are required before you go off campus and try to find a provider to give you care. We are a full primary care physician clinic here on campus available to you. And if we aren't open, the after hours nurse is your first resource. If it is an emergency, you definitely want to go to the nearest emergency room. If it's an urgent situation and you're not sure if you should wait until the next day, then go to the nearest urgent care. And again, the bus routes over to Villa La Jolla Drive where you can access the urgent care. It is a $25 copay under your insurance to see the urgent care under the SHIP plan. If you do go to the emergency room, it's a $150 copay. So you pay that first and then the services are covered thereafter, depending on who you're seeing by the insurance plan. If you need routine care or ongoing care, or you need to see a specialist, the provider here at Student Health is going to write you a referral for that care. So you need that in hand. That's your golden ticket to see the next level of care. If you need an X-ray, an MRI, a CT scan, the doctor here is going to write you a referral for that care. And the first financial cost savings that you would take would be to go to UC San Diego. If you need to go see an Anthem Blue Cross provider, again, it's going to be covered at that tier of benefits. So get your referrals timely. As May said, we're here year round, so you just give us a call. You can schedule an appointment, you can do a telehealth visit, or you can ask for a referral offsite. Under this student health insurance plan, you also get supplemental dental and vision coverage. And supplemental means that it's not covered at a unlimited rate. There is a cap on it. So under the plan, you do receive unlimited medical and mental health care. But for dental, they give you $1,000 worth of coverage under Delta Dental PPO, which is a very utilized plan in the state of California. 95% of our dentists are contracted with Delta Dental. So definitely contact Delta Dental or go on their website. You don't need a referral for this care. And find a provider that you want to go see, give them a call and schedule an appointment. When you go see them, the cleaning and x-rays are covered in full. If you do need a curative services like a filling or fillings or a root canal or a tooth extracted, those services are covered at 80%. And you're going to pay 20% of the bill and anything that would exceed that $1,000 limit. There again is no referral required for this particular service. We don't have dentists on campus, and I think you probably know that because we don't have a dental school. So all of our dentists are in the community, a short shuttle ride away or a bus ride away. Blue View Vision is the vision carrier under this plan, and they provide you with one eye exam each school year, and that would run from August 1st to July 31st each year. It's renewable, and they also will provide you with $120 to pay towards a pair of glasses or contact lenses once per school year. If you want to make an appointment, you can contact our student health optometry by calling the number provided there for you to schedule an appointment. You can also schedule that in My Student Chart. If you want to find alternate providers that may be contracted under this IMED plan, call Anthem at the 866 number they're provided. They'll ask you for your zip code and they'll give you a list of providers that are nearby. You don't need a referral for this care.
Thank you, Jill. I'm actually gonna just type this real quick and send it. Okay. All right, so for those who want to avoid paying the registration health fee for UC SHIP, please listen up. You'll want to be registered for fall quarter. That means you selected your fall classes and the fall quarter fees matriculated to your Triton Link account. That's when you'll be able to access the online health fee waiver. And within that, you'll just answer the questions based on what is asked and answer it based on the insurance that you have. This has to be filled out in a timely manner for consideration. All students must have a comprehensive insurance that meets the UC Office of the President's waiver criteria in order to be approved. The QR code that you see in the center will take you directly to the University of California insurance requirements that Jill and I did not write, but we are sharing it with you since this is set forth by the Office of the President. So please remember that all students must renew their health fee waiver each academic year, and we do not accept late waivers or requests for retroactive waiver applications. Lastly, if you are considered an international student with the university, there is a requirement that you'll have to fulfill as well, including the medical repatriation and evacuation. So if you do have comparable insurance, please mark your calendars that you have to be registered for fall quarter. The waiver application is going to close on September 14th. There will not be any late waivers or retro waivers accepted. This has to also be completed each school year, prior to the school year. Lucky for those who forget to submit a waiver application on our student health insurance website, there are dates for the upcoming waiver applications in case you missed this one. And so what you see, oops.
Sorry.
That's okay. So what you see here is access to the Students Triton Link portal. Under financial tools, you'll see that it's the 1, 2, 3, 4th option below under financial tools. If the student was to access the application now, it'll show in red that it's not authorized. And that's because the student needs to be registered for fall quarter. Along with the waiver application, you're going to answer the questions. One of the questions is going to ask you, where is your primary care physician? If that primary care physician is over 40 miles away from campus, that's an automatic denial. So what you'll want to do is reach out to your insurance. Let them know that the student's going to be attending UCSD, and can they access a primary care physician closer to campus. We do advise UC SHIP students to check out UCSD Health and Scripps Health. Those are the two closest facilities that are walking distance. This information is also really important if you are going to have SHIP. It gives you just helpful tools on information you're going to need to know to navigate your care. You're going to have an electronic insurance card that looks like this. But for those students that want to waive out of UC SHIP, the university is relying on you to provide proof that your plan is comparable with the university's. So if you don't know what to do or how to start with your health plan. If you can't, you'll automatically be charged with UC SHIP. Thank you, Jill.
Oops, sorry, got a little ahead. So as May indicated, if you have your own home insurance or your parent wants you to use their insurance instead of having the school insurance, it's super important that you file that waiver timely. Again, the waiver is open, and when you register for school, just hop right on to the Triton link and fill out your waiver application. It's about 10 questions that are very easy to answer. The answers are generally found on your insurance card. And if you do need further information, you'll want to contact your insurance to get that information. The waiver criteria, as May indicated, was built by the University of California Office of the President, and it requires that you have a primary care physician assignment if you do have a Medi-Cal plan, Medicaid plan, or a HMO benefit within 40 miles of this campus. So you'll want to square that away with your insurance company before you apply for that waiver. The waiver application will be submitted and validated for eligibility. As long as your plan meets the requirements, you will get an approval. All of this information is sent to you via your email through UCSD. So if you have a personal email, they're not going to send it there. This is private information. So they're going to use your UCSD email, and that's where the campus is use all of their means of communication through the email. So please pay attention to it and read the emails that come through there, because they could cost you a lot of money. So take a look at that. As part of the waiver application, the last question that's offered is, would you like to pick up a raft? If you are filling out the application, it'll also provide you a link that will take you to our website that will explain the raft offering. I am a parent, and I sent a student away to a campus that was a few states away from me. My insurance didn't work over there as well as it does in California. So I would pick up this bridge plan, just like you might want to consider, so that my student could go to the student health clinic and have as many visits as they wanted to without limit. They could have their lab services and their x-rays done at no additional cost other than a one-time quarterly payment of $70. So that last question is offering you the raft benefit, and that is $70 per quarter for you to have unlimited office visits here with our primary care physicians. And again, you can schedule by calling or going on my student chart. You can have lab services, as many as you want during the quarter under that $70, and as many x-rays as you'd like to have without paying any additional fees. If you do require specialty care, then we're going to help you navigate through your insurance to find the right provider in the community that will pay those services for you. So it's peace of mind for the parent to consider this raft so that their student can wake up, and if they have pink eye or they have a cold or the flu or they have something that is bothering them, they can be seen that day and have an initial evaluation. And then if further care is needed, then they're going to work with the insurance team here to ensure that they can go see a doctor or a provider under your insurance. Please take a look at our website so you understand the details of this, because it will pay for itself in one visit. To see a doctor here at our student health clinic, it can range from $89 to $119 for one visit. If you have lab services, you will pay an additional fee for each lab service. If you have an x-ray, you'll pay additional fees to have that x-ray. So if you pay $70 for 10 weeks during the fall quarter, you can come in as many times as you want and talk to a doctor about anything that's bothering you. So please consider this benefit. It's not an insurance and it doesn't work outside of the student health clinic, but it is good peace of mind for parents to know that their students can wake up and come to a facility and have an initial evaluation and go from there. The RAFT offering does not include prescription coverage. It doesn't pay for any dental work or optometry. It doesn't pay for vaccines or services obtained outside of our student health clinic, but it does pay for an initial evaluation, lab, and x-rays. So please consider it.
Okay, so as you already know, we don't accept international health plans for the health fee waiver, but these are a few accepted insurance plans that meet the UC insurance requirements. So if you are considered an international student and you are looking for alternative coverage, this is something you'll want to take a picture of and just review each of the options that each health plan offers to see if it fits your needs based on your visa and, let's say, your medical needs. But ISO Care Plan, PSI Platinum Plan, and the Student Medicover Plan are all comparable. They do meet the criteria. So if you were to waive with these plans as an international student, they will be accepted.
So we're almost wrapping this slideshow up. I know it's been a while and we'll answer your questions in just a minute, but I do want to give you a timeline. Our health fee waiver is open for those returning students and students that have registered for classes. The waiver is open to you on the Triton link. Now's the time to figure out, do I want to keep the SHIP insurance or do I want to waive it? Do I want to avoid paying that fee? Look at the health fee waiver online, see if your insurance meets the requirements and fill that out if that's what you desire. Otherwise, you will be automatically enrolled in the insurance. The September 14th is the deadline to apply for a health fee waiver. And that's during our routine time frame, so you don't pay anything extra to file that waiver from May 6th to September 14th. There is a secondary late waiver time frame that runs from September 15th to September 20th, but that does require a $50 late fee if you do file your waiver during that 6-day period. You don't want to pay that, so definitely file it earlier, and you will register in August sometime, so you'll have time to do it. If you call us on September 21st, we're not going to be able to help you with the waiver. So please adhere to these time frames. And then the first day of school is September 23rd this year. And that's the first official day of fall. And it's the first day that the SHIP insurance is available to you so that they'll start paying benefits. That's your effective date for the fall quarter.
Okay, let's provide you with some resources to tap into if you have any insurance related questions.
There's a lot here. but I wanted to make sure that you have everything available to you. And again, this is on our website as well as it'll be part of our slideshow. If you do have any questions about the Student Health and Wellbeing Clinic, please take a look at our website, see what we have to offer. We have our providers' resumes right there, any of their interests, any subspecialties that they have as a primary care physician. We have women's health, men's health, trans health, all available to you here at this clinic. So take a look at that and pick a provider that meets your needs and make an appointment with them. We have counseling and psychological services that we partner with, and they provide lots of online options for mental health and behavioral health. And also they provide psychologists, psychiatrists, and they can write referrals off campus for you to see someone if you need to. The student health insurance information is there for you. Our website is available. If you want to give us a call or if you want to send us an email, we'll be glad to communicate with you. We have Zoom meetings so you can have a face-to-face encounter with one of our insurance coordinators. The addresses for the Zoom are right there for you. And then the health plans. Anthem Blue Cross, again, is the SHIP insurance plan. Delta Dental is the supplemental dental carrier. Optum RX is who you would contact for any prescription or formulary questions. UCSD billing is who you would deal with if you have any health-related services at the hospital. Academic Health Plans is our brokerage to enroll students, and they also manage our waiver process. UCSD Financial Clearance will provide you with a quote of how much it might cost you to have a service at the hospital. And the San Diego Medi-Cal office here in San Diego that's closest to our campus is in Kearney Mesa. If you are a Medi-Cal recipient and you need to transfer your care from one county to the next, please contact them. It takes about 45 days for that process to happen. If you are an HMO member and you're changing your primary care on your insurance, it takes about 30 days for that to happen. So act timely, make these transitions so that you will effectively waive the insurance or be part of it.
Just wanted to say thank you again for joining us with our first webinar of this academic year for the summer. And if you have further questions, don't hesitate to email us at ship3@ucsd.edu. Also, our main line, 858-534-2124. Keep in mind, if you do leave a message, you'll want to speak in a slower, clearer voice so we can retrieve that and contact you immediately.
And also, we're on Instagram, Facebook, and YouTube. So we have lots of valuable information out there that you can, access at your fingertips. And again, this recording will be on our website, so you can take a look at it later or refer back to it with a parent or a guardian. But follow us on social media. There's lots of posts that happen in Facebook. On Instagram that are from our health promotions department. If you are an aspiring healthcare provider, you want to be a doctor or a nurse, we have lots of opportunities for you to shadow our programs here on campus. And also you can participate with campus events that are happening. There's lots of tools that they will give you to manage mental health and other significant questions that you might have about living here in San Diego, and making friends and finding your way here. It is beautiful here, and there are lots of people. I'm so glad to have you here, and I welcome you to UCSD. And now May and I are going to take some time to answer any questions that you might have.
Yes, we do have a few questions. Someone asked if UC SHIP can be used on the East Coast.
It's a great question. This plan is global. So you can use it in the United States, and you can use it if you do travel abroad. So if you do plan to do like a global seminars or a travel abroad program for a quarter or a half a year, this plan will cover you. If you're outside of the country, it's covered at 60%. The beauty of that is that healthcare is a lot less expensive outside of the United States. So you would pay up front, and then when you come back to the United States, you would seek reimbursement that way. If you're on the East Coast or you're Midwest, you're going to use Blue Cross providers outside of our general area here. So you just want to contact us, secure a referral so that you know that the claims will be paid appropriately. We'll write you a referral to see a primary care doctor or a specialist, or to have that procedure or diagnostic procedure that you need, and have the insurance pay on that at the appropriate level based on who you're going to see.
Thank you. We have another great question. Can we start using UC SHIP in the summer before starting the university?
Unfortunately, you can't. It starts the first day of fall, as I indicated this year, it's September 23rd. So you wouldn't be able to use it over the course of the summer. If you are in San Diego, you can use our services here at Student Health. You just have to pay as you go. And you would seek reimbursement with your home insurance company, or you would pay that fee, which is far reduced than accessing care in the community.
Someone's asking if they should wait to submit a waiver if their current insurance will be renewing this summer. Does our insurance need to be current year when applying for a waiver?
You could apply for the waiver with the insurance that you have. They're going to verify your insurance on a monthly basis. So they may ask you to update that information if it does change. You would just contact us, send us an email, and we'll be glad to assist you with getting that insurance updated. If you want to wait, just make sure that you don't wait too long. Again, the waiver is open until September 14th. So you would need to have your insurance in place and active by that point. So you could apply now with the insurance you have, or you can wait until you have yours, as long as it's going to be before September 14th.
Okay. Let's say for someone who's trying to waive out of UC SHIP, if they receive a denial and they feel that their plan does meet criteria, what should they do?
So when you file that waiver, when you hit submit, you will immediately receive a tentative approval email to your UCSD email. It's going to tell you it's going to take 7 to 10 business days to make a final decision and to watch your email for that final decision. If the final decision is an approval, no problem. That we're going to waive the insurance, you're not going to pay that fee, and that'll be good for the year. You do have to renew that waiver every academic year before fall. So keep that in mind. If you are denied, the denial letter that goes to your email will have a hyperlink to an appeal process. You file the appeal information, send it to the address that's indicated on that form. It'll be reviewed and a decision will be made quickly by our campus, depending on what your reason is for that denial.
Okay. Let's see. Someone asked if we can provide a link to find a provider out of the country. And so I'm just providing the myucship.org website specifically for when you're away from campus. So just seeing that.
He's really good at dropping links in the chat, so please watch for those. She had also indicated that we have a waiver criteria. She'll drop that into the chat as well, so you can take a look at it and match it up against your insurance to make sure that it does meet the requirements. It's really based on the Affordable Care Act. So as long as you have a plan that has unlimited coverage, you have a doctor nearby that you can access without any problems, it doesn't have a pre-existing condition on it, then that's going to usually meet the waiver criteria. The plans that don't meet the waiver criteria would be those that are travel plans, international plans, or plans that don't provide you with unlimited coverage, or if you don't have a doctor nearby that you can go see while you're attending the campus.
If a student had Kaiser, but they didn't have transportation, how can they get seen? Should they get removed?
Unfortunately, there are Kaisers popping up all over San Diego, but you would want to contact Kaiser and find out what the nearest facility is, and then probably look at public transportation to see if there is a bus that will take you over to that area. We don't provide transportation to students to get to their own insurance, so you'd have to use public transportation or find a really good friend that has a car here on campus.
Thanks, Jill. Let's see. Someone's asking about physical therapy. Can they get physical therapy with UC SHIP?
For sure. So physical therapy is a covered benefit under the insurance plan. You do have to have a prior referral from the student health clinic.
If a student with UC SHIP goes to another UC student health on campus, will that cost the same for services?
It will. So if you are, again, are in the Irvine area and you want to go to the UC Irvine, you can do that and you can present your SHIP card and they'll be able to bill the insurance company for any services that you have there. You shouldn't have any out-of-pocket experience other than if you do waive the insurance. It just allows you to go see the provider. You pay out of pocket if you waive the SHIP.
Okay. And if a student has PPO plan, are they needing to establish a primary care physician?
Great question. No. PPO benefits are payable throughout the nation, so you would just want to contact your insurance so that your student knows who to go see in the community. And again, probably look at transportation to see how far that provider is away from the campus. But we do accept a PPO benefit. Point of service PPO or EPO will fly right through our waiver system. If you have an HMO and you're tied to a provider outside of the campus radius of 40 miles, then you'll have to transfer that student to an HMO provider near our campus. Or if you're on a Medi-Cal or Medicaid plan, you'll want to contact the county provider and see if you can transfer to San Diego.
Is it possible to get a refund for transportation under UC SHIP?
Health insurance doesn't pay for transportation, so that is an out-of-pocket expense to you.
So we know that there is no dentist on campus. If a student wants to locate a provider under the Delta Dental website, do they just call anyone on that list?
Yeah, it's a significant list. So you may want to take an extra step and look at their website, see if that particular provider is what you're looking for. Dentists, you'd have to look into it and see if it's someone that it specializes in, like cosmetic services. You don't want that. You need someone that's a curative or preventative dentist. So take a look at that. It'll give you a list based on the zip code, and then it's up to you to decide which one you want to go see.
Would you be able to discuss about the ambulance situation if a UC SHIP student needed an ambulance to the hospital? How is that covered?
Sure. So we are right across the Interstate 5 freeway. Our campus sits on one side and our health system sits on the other. To give you an example, if a student were living here on campus and they had an emergency and they were covered under the health insurance plan through the school and they dialed 911 or they called the emergency resources, they're going to send an ambulance. That ambulance is going to transport the student across the freeway, which is probably less than a mile from us. And that ambulance ride is generally going to cost about $1,400 to $1,700. That's $1,700, a lot. And it all depends on what's going on. If they have to do life saving measures, if they have to put oxygen on you, if they have to provide an IV, all of those charges are unbundled, meaning that they're charged separately. And that bill is going to go to the insurance company. They're going to pay it at 80%. The $500 deductible comes into play. So even though it's an emergency, it's one of the most expensive lessons that a student can learn here on campus. You pay the $500 deductible, and then the services are covered at 80%, leaving you with 20% of the bill. On average, a student is generally paying $700 to $900 out of pocket to pay for that ambulance ride. Even though it's an emergency and it's out of your control, it is very expensive. So If it's an emergency, it's an emergency, and we'll help you with that. If you contact our offices, we have a Care Assist Fund available for those kind of emergencies. So take a look at our website. There's information on that and how to file that request. But generally it is an out-of-pocket expense to the patient. So if it's urgent and you can get somewhere by a public transportation, a ride from a friend, take that, because that's gonna be a lot less expensive than an ambulance ride.
Thanks, Jill. Let's see. We actually don't have any more questions.
We'll sit on the Zoom for the next 6 minutes. Our time is up at 2 o'clock. So if you do have questions, we're here for you for the next few minutes. I just want to reiterate that the health insurance won't start for you until September 23rd. If you do plan to waive, look at your health insurance, make sure that it meets our requirements, and that you file that health fee waiver timely. You will see other communications from the campus going to your UCSD email. Please take a look at that, read them over. You may need to respond timely, or again, it may cause you to have a charge on your account that you didn't expect. So please make sure you're looking at your email.
In the chat, I did add a copy of the summary of benefits and coverage for UC SHIP. It's about like an 8-page summary. If you're a student wanting to waive out of UC SHIP and Academic Health Plans is asking you for proof of your insurance, this is a similar document that you can ask for from your health plan. And you just want to read your plan, make sure you understand it and see that it is comparable to the UC requirements.
And those schedule of benefits are at your fingertips. Go to your website. You can usually plug in your health ID and then you'd be able to print it right from there or do a screenshot. I do see a couple more questions. How we get a medical certification for a program under UC SHIP. If you're part of a diving program and you need a certification for that, that is an out-of-pocket expense. It's an elective process. You decided you wanted to be part of that program. So you can come here and get that clearance. You would just have to pay for it. And you can schedule your appointment by calling us or going on My Student Chart. The same would go for like DMV, the Department of Motor Vehicles here in California. If you wanted to get a driver's license, they now require that students have a letter from a facility indicating that they have health insurance. Contact us. We'll provide you with that. But if you do need a medical certification for any reason, for optometry or something like that, that's something you'd have to pay out of pocket for.
If a student missed the waiver deadline this time around, a link was added to the web chat, and it just gives you all the upcoming waiver dates in case you missed this deadline.
I think there was one more, May.
How much do we need to pay for the medical certification?
It depends what kind of form it is. So you'd want to contact our offices and they would be able to give you a quote before coming. But again, our services here are at a reduced rate. So if you're coming here for a primary care physician visit or a travel visit or some sort of form to be filled out, you're going to pay from $89 to $119 for that visit. If you went out in the community, it could be upwards of $300 to $500 to have a consultation with a doctor.
Did we get it? Okay. I added the link of the cost comparison for services at SHS if you were to have SHIP or waive out of it with draft or opt out of everything.
Great.
And thank you everyone for attending.
We really hope this was helpful to you as you try to figure out all the decisions that you need to make for coming to college. Again, we are a beautiful campus that provides sunshine most of the time, not today. It's a little overcast, it's a little June gloomy, but there's lots to do outside. Lots of ways to hurt yourself. So be careful. We have scooters and we have skateboards and we have bikes, and sometimes they collide. So please be careful, take care wherever you can. And if you do have a chronic illness, or if you want to talk to us about any care for yourself that should be in a private environment, please contact us by telephone 858-534-2124, or send us an email at ship3@ucsd.edu, and we'll be glad to assist you with transitioning your care from your home environment to the school. We're gonna go ahead and wrap this up for today, but you'll see it on the website. There will be a webinar offered twice a month through the summer. So if you do need to tune in again, or you have a friend that needs to do that, or a parent or guardian, please do so. Our website will contain all of our future webinars. So we really appreciate you being here with us. You've seen our faces, so please say hi if you do see us throughout the campus. We attend many tabling events and different events throughout campus. We'd be glad to hear from you. So, and help you in any way possible. So good luck with your entry into college. Have a fun summer, because you're going to do some hard work here. And I really appreciate May and her time in providing this presentation today. Thank you.
Thanks.
And go Tritons. Thank you.